Thank you very much, and thank you for attending the session. What I'd like to do is summarize the data for long-term outcomes for laparoscopic liver resection. Back in 2009, when a world review was published on almost 3,000 cases, 50% of the cases were for malignancy. A more recent world review by Ruben Soria shows now almost 10,000 cases, and the percentage for malignancy has increased from 50 to 2/3 or 65%. So that's 6,200 cases shown there, with 50% of them being hepatocellular carcinoma and 26% being metastatic colorectal cancer. Of the 6,190 cases, the 50% represents 3,000 cases of hepatocellular carcinoma, which is the top row going across, and the second row is colorectal cancer liver metastasis at about 1,600 cases. So for the long-term data, we're going to focus on these two disease entities, HCC and metastatic colorectal cancer, because even though there's a smattering of other solitary metastases such as breast cancer, we don't have good published 5-year data other than for HCC or colorectal mets, which makes up the vast majority of indications for lap liver resection for malignancy. I'll start with metastatic colorectal cancer, then we'll move on to HCC for long-term outcomes. And in general, we look at 5-year disease-free and overall survival for long-term outcomes. This was a multi-center study of 6 centers published in 2009, where the overall survival was 50%. In green, you can see the median tumor size there was 3 centimeters, R0 margin negative rate 94%, median margin was 10 millimeters. This is a French head-to-head study. I don't know if Brice is in the room here, but it was basically 2 centers taking 60 consecutive metastatic colorectal cancer cases, 1 center being Paul Bruce doing all open, and 1 center being Professor Gaillet doing all laparoscopic, and with best practices, and the 5-year survivals were comparable at 64 versus 56%, and no difference in disease-free or overall survivals long-term. This table lists 18 studies that are now published from 2009 to 2016. The top 2 are the studies I just showed, the multi-center international study and then the French study, but the 3rd study down is from Wakabayashi, the 4th study from Cherki, and all the way up to Mo Abu Halal's British Journal of Surgery 2016, all with 5-year overall survivals. And the general range is 50 to 60%. There were a couple in the 40s and a couple hit 70%, which is commendable. But in general, the 5-year overall survival, about 50 to 60%. Of these 18 studies, not all 18 were case matched to open. So on the next slide, this slide shows 11 studies of those 18 where, in addition to reporting 5-year overall survival in lap liver resection, they case matched it to open liver resection. These are the number of patients in the lap versus open group for each study. And these are the 11 studies that had 5-year overall survival. And every study concludes the same, NS, meaning there was no significant difference, meaning lap liver had no worse outcomes than open liver resection for colorectal mets when they were matched. A couple of these were propensity matched, and the others were just matched based upon some parameters. But this really got our team wondering, well, there's certainly a selection bias because a surgeon doesn't typically take a patient to the OR and do a lap liver resection if there's known 8 or 10 colorectal mets ahead of time. So one of the criticisms early on was, well, you're picking the easier cases for lap. So we did a meta-analysis on the next slide where we picked the best 8 studies that were the most rigorously matched, that had at least 10 patients per group, lap liver versus open liver, and they had to be matched for every parameter: tumor size, tumor number, extent of resection, and the best 8 that were in the literature. And if they didn't match, if they were missing a single factor, then we didn't include them. So we did find 8 studies that matched all of them. The short-term outcomes were what we just heard. So let's focus on the last, because I was most interested in, well, how many colorectal mets are there really in these studies? And so the median number of mets in the lap group was 1.4, open group 1.5, so extremely well matched. And the 5-year overall and disease-free survivals were comparable, 51 versus 46 and 32 versus 26. So our conclusion from this meta-analysis was that the current data analyzing rigorous case-match studies supports lap liver resection in patients with limited colorectal mets, meaning 1 or 2. While there are plenty of studies out there that have more than that, when you have a median of 1.4 or 1.5, that means that half the patients had 1 and half basically had 2. And this is a study that shows similar results. This is from Beppu and Wakabayashi. It was a multi-center Japanese propensity score match. So this is the largest study of 5-year data because it's a 1-to-2 case match, 170 lap liver versus 340 open liver resections. The median number of Mets in the lap group was 74, meaning 74% of the patients had 1 metastasis. They didn't actually give the median number, but they grouped it by these groups. So 74% had 1. A quarter, so basically 99 out of 100% of the patients either had 1 or 2 to 4. Unfortunately, we don't have the breakdown. What was it, 2? How many of them, these 25% were 2 versus 3 versus 4? That would be nice to know. Maybe they can go back and look at that. And less than 1% had 5 or greater lesions, and they had no difference in the R0 5-year disease-free or overall survival rate between the two groups. And the excellent 5-year survival is 70 versus 68. Now we move on to HCC, and here are a dozen studies, again matching lap versus open, the number of patients going from 2001 to 2014, and no difference in 5-year overall survival for HCC. A similar Japanese propensity score match of 31 centers. This was a 1-to-1 match, putting 387 in each group. The patients were well matched, and no difference in 5-year disease-free or overall survival for hepatocellular carcinoma. This is what their survival curves in the propensity score match for HCC look like, the open group and the lap group superimposable. 5-year overall survival, 77 versus 71. I'll finish with 2 meta-analysis. This was for HCC in 2013. They were well matched of 15 non-randomized studies, and there was no difference in margins, 5-year overall survival, or recurrence-free survival between the groups. And this is the most recent meta-analysis I could find published only 2 months ago. And you can see now they're up from 15 to 44 non-randomized studies. This is published in Updates of Surgery. Case match, large number, 2,000 lap versus 3,000 open, and their odds-weighted ratio. What struck out to me was about the R0 resection, because they said lap liver had favorable for R0 resection, while there's been a few scant anecdotal reports suggesting that. It really made me wonder, well, are they really comparable? And the 5-year disease-free and overall survival is equal, but there was a flaw there in that when you went back and looked at their meta-analysis, the lap group had smaller tumor size versus the open group, so therefore I'm skeptical about the conclusion, because if you have smaller tumors, then maybe that's the explanation for why you have a better, higher R0 resection rate, and they're not really comparable, because some studies, while they had equal, the studies that had better R0 maybe had smaller tumors, because you can see on their curve here, the diamond doesn't touch, which means significant, but you have to interpret that based upon the smaller tumor size. So I will conclude by saying lap liver resection has been performed in over 10,000 cases worldwide. The comparable long-term outcomes of 5-year disease-free and overall survival and short-term R0 rate have been reported in lap liver resection for HCC and limited colorectal metastasis using case match controls, propensity score matching, and meta-analysis. And we await the long-term data in the randomized clinical trial, and maybe we'll get some. This introduces our next speaker, Dr. Bjorn Edwin from Oslo, where we'll see if he can enlighten us about at least the R0 rate, median number of Mets, and tumor size. And so we look forward to the cancer data. Thank you.